Good morning, everybody. Can I state at the outset my deepest appreciation to the New South Wales Police Force and to Service New South Wales, who under very difficult and stressful conditions have managed to process in excess of 50,000 permits overnight. The Commissioner will outline in further detail, but the feedback we've had from the border is that the relationship between communities and the police has been extremely positive, people appreciating and understanding the circumstances we find ourselves in, and the fact that this will be a stressful few days for many people throughout both parts of our states. I also want to stress my appreciation to Service New South Wales and the staff who worked literally overnight to process in excess of 50,000 permits which have since been issued, which includes people in those border communities but also those with other extenuating circumstances. I do want to send a very strong warning. The probability of contagion in New South Wales, given what's happening in Victoria, is extremely high. The probability that we need to be tougher on those border restrictions is extremely high. I ask everybody in those border communities, including residents in New South Wales who live in Albury or Moama or other places across the border, do not travel to other parts of New South Wales unless you absolutely have to. If you are an Albury resident, we do not recommend you travelling to other parts of New South Wales, and if we feel in the next few days or as early as tomorrow that we need to further protect the community, we will consider what we do north of Albury. Now, I know that's an imposition also for people who live in other parts of New South Wales, but my strong warning to people in New South Wales is do not travel to those border communities unless you absolutely have to. Absolutely have to. We can certainly control what happens on our side of the border. We can't control what's happened on the other side of the border, and I've already had advice this morning of at least one person from Wodonga who has the virus. We're still awaiting details. But given the appreciation we have for police and Service New South Wales in standing up the permit process, that carries with it enormous risk. Because when you have communities mixing with each other, crossing a border, it carries enormous risk. So I will stress that the government is considering what further action we take to make sure the bubble, as we call it, of those border communities is maintained. And so for communities like Wagga and others who have close interaction with people in Albury, I ask you not to visit those border communities from other parts of New South Wales unless you absolutely have to. And similarly, we say to New South Wales residents who live in those border communities, do not move outside your border community unless it's absolutely necessary. Otherwise, we will need to take further action which could further compromise your ability to move freely. We don't take these decisions lightly, and I appreciate people will have varying degrees of opinion on what occurs, but I have no doubt what the responsibility of the New South Wales Government is. We're providing every support we can to our Victorian counterparts. The situation in Victoria is extremely serious. And I also want to stress that the border closure between New South Wales and Victoria cannot be compared to any other border closure around Australia. No other border has at least 55 places. No other communities, even though there are some border communities obviously impacted or were impacted with New South Wales and Queensland, New South Wales virtually had zero community transmission on those borders. We can't be assured that's the case with Victoria. So whilst we've allowed these permits, whilst we've allowed a degree of flexibility until this point, do not assume this will continue. We are monitoring this situation every few hours because, as I said, whilst we're assured of the advice we get on this side of the border, the Victorian government, the Victorian community is under immense pressure, and the contact tracing and other practices we have on this side of the border, we can't be assured are necessarily happening on the other side of the border. And so for that reason, the government will be considering potentially further action in relation to those border communities. I know I've already said it in the last minute or two, but I want to say it again. If you live on a border community and you're a New South Wales resident, please do not travel outside your border community at this time. If you are a New South Wales resident outside of those border communities, please do not go to those communities unless you absolutely have to. We are in a high-risk situation, and I don't want to see the good work we've done in New South Wales undone. And I issue a warning that if the government has to take further action, we will. I also want to foreshadow that it won't be anything major, but we are considering tweaking some health orders in New South Wales to ensure additional safety in relation to some types of gatherings, and we will have more to say about that tomorrow morning. But I just want everybody to be on notice that we're reviewing, given that we do have so many permits that have been issued. We've got so many people from Wodonga and other community borders moving across the border. That level of risk has to be assessed against what we have in New South Wales. And whilst we've respected the right of those communities to continue, we will continue to assess that, as I said, on a daily basis. I also want to stress to businesses, not just in those border communities, but especially in those border communities, but also throughout the state. Whilst it's pleasing to see that over 100,000 businesses have downloaded the app on how to be COVID safe, the checklist on how to be COVID safe, there's only been about 10% of those businesses who've actually gone through the process of registering. Now, I'm concerned with the lack of compliance in New South Wales of some hospitality venues, in particular cafes and restaurants. Basic things like sharing a salt and pepper shaker, for example, and I get to that level of detail, but basic things like that are a health risk. And when businesses choose not to adhere to the checklist, it is a risk to everybody. And we will be stepping up, and this is why Minister Dominello is here. And in addition to thanking him for what he and his team have done overnight, he and I are also here to deliver a very strong message of compliance. We will be stepping up compliance in relation to businesses throughout the state. The onus is on those businesses to make sure they're COVID safe, but the onus is also on us to make sure we don't frequent a business that's not COVID safe, and we certainly raise the alarm if a business is not progressing in a COVID safe manner. So today my message to New South Wales residents is thank you so much for the work we've done so far, but the bubble, the so-called bubble we're creating in those border communities will only work and be successful if we have strong compliance. And if we see that what we've allowed at this point is too much of a health risk, we will need to take further action. And again, we are dealing with, first of all, closer geographic proximity to areas which have high levels of community transmission, a high number of border crossings, and also interaction with those border communities unlike anything else we have in Australia, and that in itself poses an extremely high risk. I cannot stress that enough. But I again say how grateful I am. New South Wales has been able to come this far so far because of the outstanding teamwork we have. How the police have managed to do what they've done in the last couple of days is just outstanding. To service New South Wales, what they've been able to stand up overnight, to know that in excess of 50,000 people have a type of permit today in 3 different categories to be able to make those border crossings, and also the work of our health officials. It's become apparent to me that the high level of logistical organisation, the contact tracing, the testing that we have is really holding us up well. And can I also encourage people on those border communities to get tested? If you have a scratchy throat, if you sneezed, go and get tested. I also want to issue the same warning for people to get tested, and Dr. Chant will have further to say about this. In communities like Merimbula, where there have been a lot of people holidaying, in communities like Ballina, where there have been a lot of people holidaying, sometimes an infection can bubble away for a month or so and bubble under the surface. So we need to be additionally vigilant in those communities which have a high number of tourists. When I say tourists, obviously from other states, but especially Victoria. And I ask communities in particular on the border, at places like Merimbula, places like Byron and Ballina, to make sure they get tested at the mildest symptom, because it's our high rates of testing and the contact tracing that will keep people as safe as possible. It is a critical phase in the pandemic, And as I say, the spillover into New South Wales, because of those existing connections, is extremely high. And we're doing everything we can to reduce that, to suppress that, which has been our strategy all along. But I also do want to issue a warning, and can I be plain about this? And I'm sorry I have to be so strong, but it doesn't bother me how many people are personally upset with me, the decisions we'll have to take. But we have to protect the community. We have to protect the community. And I ask everybody who feels that their freedom is limited or what they're used to doing is limited, think about the consequences. For our poor Melburnians, to be in lockdown for 6 weeks is not a situation I want anyone in New South Wales to be in. And we have to take every measure we can to make sure we don't find ourselves in that situation. So I appreciate you might be angry and frustrated and you might have to wait a bit longer, but think of the consequences if we don't do what we're doing. Think of what the alternatives are. And again, I will continue to make decisions on behalf of my government and based on the health advice completely freely. What people say and what they don't say is of no consequence to me. The decisions we take have to be based on public safety. And I also want to express again my deepest gratitude that I feel incredibly fortunate to have such a strong team in New South Wales. Our ability to coordinate our activities and to logistically implement decisions in a very short amount of time gives me confidence that we will continue to be able to do that. But I also put our border communities and other communities on notice to say things are evolving, moving very quickly, and accordingly, I don't want anyone to feel surprised by any decisions or announcements we make in the next few days. And again, although I've said it multiple times, I really want this message to get out. If you are in a border community, do not travel anywhere else in New South Wales. If you live near a border community, for example, if you're in Wagga or other places close to Albury, do not travel to those border communities. That is all a high-risk activity at this stage, and we've made sure that we have provision and availability for people on those border communities in Albury and other places to get tested, and we expect that level of testing to also increase and be very high in other parts of the state where there may have been tourists or people for a long period of time travelling back and forth. And I also stress in the strongest possible terms that anybody in the state who has the mildest of symptoms, please come forward and get tested. And again, I stress to all of our businesses, especially cafes and restaurants, and even socially when we're meeting with people, do not let your guard down. Letting your guard down could have horrible consequences for all of us. All of us should maintain our social distancing, no physical contact with others, 1.5 metres, 4 square metre rule, hand hygiene. We have to stick to that and make sure others around us do as well. Again, I can't express my gratitude enough to all of the government agencies that have come together, and I also want to express my deepest appreciation for the patience demonstrated by the border communities. But please know that we will continue to evaluate the high risk on an hourly basis, and if we have to make decisions accordingly as a government, we will. I'll now ask Dr. Chant to give us an update overnight. Then Commissioner Fuller will talk about the border conditions. Minister Dominello will talk about business compliance and Service New South Wales, and then we'll be open to take any questions. Thank you.
Thank you, Premier. So there have been 8 new cases of COVID-19 diagnosed in New South Wales in the last 24 hours. 7 were in returned travellers in hotel quarantine. There's an 8th case, which is a woman in her 30s from southwestern Sydney who tested positive for COVID-19. Further investigations are underway to determine the timing of her infection, whether it's a historical infection or a more recent one. And there are her close contacts, including some health staff at Liverpool Hospital, are in isolation pending the outcome of those investigations. There is also a teenager from Victoria who's holidaying in Merimbula who has been advised by Victoria Health that they're positive. Now, just to be very clear about the circumstances around this child, the child and his family were not from a hotspot in Melbourne at the time of leaving Melbourne. They also undertook testing before coming to New South Wales. and were actually advised that the test result was negative. But following their arrival in New South Wales, they were then advised that that had been an error, and in fact the test result was a positive. All of the family contacts have been in isolation, and they're now isolating in Merimbula. And the only event that the family did outside the family group was visit the Tathra Hotel. Pleasingly, and this stresses the importance of some of the actions that have been put in place, the Tathra Hotel did have a COVID safety plan in compliance with the requirements, and the risk to other patrons has been assessed as very low. But as a precaution, we're actually following up the 80 people that were in the hotel, because the hotel had also kept a list of patrons. So again, that reinforces why we request that patrons comply with those requirements about leaving your details for this very circumstance. Overall, the 2 probable cases in Albury are still, there's still further investigations being undertaken in relation to those, and I'm very pleased with the community response. We had a large number of people presenting for testing, and I appreciate the community turning out for testing. In terms of ICUs, we have 1 patient in ICU, but that person isn't ventilated, and thank you.
Yeah, good morning. Thanks, Premier. As you were aware, last night New South Wales Police delivered the border operation between New South Wales and Victoria. 650 police forward deployed, with 5 forward commands and a command post running out of Albury. So far the experience has been a positive one. I thought the first 72 hours would be more complex, there would be more traffic. We know that at some of the points there were 3 to 4 kilometre queues, but the community that we were dealing with from a police perspective were very understanding. Some vehicles have been turned around, sent back to Victoria because the drivers came from postcodes that are of threat from the virus. But outside of that, the permit system is working, and you know, thousands of vehicles have been able to travel. Most of those have been either heavy transport or people travelling in those border town bubbles. Just a reminder for those communities, and the Premier was strong on it, is that your pass to travel is within that local community. Not only will police be on the checkpoints, we'll have Highway Patrol and other vehicles sweeping the outer perimeters of those towns, and vehicles, particularly those with Victorian plates, will be stopped, and on-the-spot fines can be issued, and again you will be turned around, sent back to Victoria, and your permit cancelled. The permit for those border towns is not a free pass for you to travel through New South Wales. It's not a free pass for you to on-travel from Albury to Wagga because you need to pick something up. That doesn't exist, and we need to be clear in relation to that. In terms of the traffic queues, I mean, we want to get those down, and we're looking at a better contraflow system for the 3 different tiers of people returning, and as we know, that is the bubble, the local towns, that is the heavy transport, and that is those who have sought a permit from Victoria. At the same time tonight, we know Victoria goes into a significant lockdown, particularly for Melbourne metropolitan area, which is nearly 5 million Victorians. So we also anticipate a lower load coming into those areas. But at the moment, the communities on both sides of the border have been extremely reasonable in terms of the restrictions that have been put in place. We need to make sure that we protect the health of the people of New South Wales, because if that's breached, then clearly tougher health orders are likely to come. Thank you.
Well, I want to start by thanking the frontline workers, such as the nurses, the doctors, the police. They are on the front line every day. But in many ways, businesses are on the second line. If they keep their businesses safe for their staff and their patrons, by extension, they help the community stay safe as well. So we need businesses to help us, i.e., please download your COVID-safe plans. Please register your business as a COVID-safe business. Please make sure that you keep your COVID hygiene standards up. Please make sure that you're recording attendance details. These things will help not just your business, but will help the broader community as we get through this together. The other thing I'd want to say is already we've had about 120,000 downloads of the COVID Safe Plan, translating to about 11,000 businesses that have registered. Those numbers have to increase. Last month, we focused on educating and working with businesses to make sure that they had their house in order. This month, we're going to absolutely put the temperature up when it comes to compliance. So it's another call out today to make sure that businesses have their COVID Safe Plan and they have registered. This is not just about your business, it's about the broader community. We all have to work together to get through this pandemic.
Premier, what will be the trigger point for one of those measures that you've possibly foreshadowed that is, a second border north of the Albury?
Well, look, we assess the risk on a whole range of factors, but we'll be watching very closely. Like, we have had additional testing from border communities, which is great, but that hasn't washed through yet. So we've had some of those results come through, and to date, the results have been good, but we can't guarantee that in the next 24, 48 hours. So we're looking very closely at the level of testing and the response from that testing. We're also looking at movements between those border communities and otherwise. Now, I appreciate the frustration that's gone on in those border communities, but please know we've made every effort to make those border communities intact. But if we find that what we've allowed to occur compromises the safety of everybody else in New South Wales, I can't guarantee that that situation will continue. So we will either need to consider another border north of Albury, for example, or else consider how flexible we've been with the permits. Now, we don't want it to come to that, but I'm putting everybody on notice that you have to respect what we've asked you to do. We've been flexible to respect the integrity of those border communities, but we also need you to help us. So do not move outside them, including if you're a New South Wales resident. You do not have a free pass now throughout all of New South Wales. And please know that for any community that lives in close proximity or has a lot to do with those border communities, reduce and eliminate your activity with those border communities unless it's absolutely necessary. Now, with the flexibility we've provided to those border communities, as I said, there is increased risk, but please know that we will need to take further action if we're not comfortable with the level of risk that we're dealing with. And I want to make that very clear. And I appreciate people are frustrated, but it's a pandemic. It's a pandemic. And look at the alternative. Look what Melbournians are having to go through. None of us want to go back into lockdown. None of us want to resort to having businesses shut. None of us want to have those freedoms limited. And so if we find that the bubble we've created doesn't work on the borders, if we feel it's too high risk, we will definitely need to take further action. And I want to stress again already that if you are a Victorian and you've got a permit, your permit is only very strictly for that border community.
Is the government considering then, or is it the option on the table to put those border communities into a lockdown process?
Well, there's a few options before us. If we're not comfortable with the arrangements we've put in place, if we feel those arrangements are too high risk, we have a number of options before us. It's either to make the permits more difficult to attain, or else have some type of police checkpoint north of those border communities to prevent interaction between those border communities and the rest of New South Wales. There's some of the options we do need to consider, and I do want to put everybody on notice, and that's why we're asking the community to work with us. Because as I said, there is no border like the Victorian-New South Wales border, which is why the decision to close the border was such a difficult one, but an appropriate one. 55 crossings, the close geographic proximity. I mean, between Albury and Wodonga, there's one major hospital and one major airport on each side of the border. That's the degree to which the communities are linked, and we've tried to maintain that one community sense. But please know that if that becomes a risk to broader New South Wales, we will need to take further action either north of those border communities or else harder provision of those permits.
Making the permits harder to access, you're referring to making permits for border town residents harder to access, so you could find someone living in Albury not being able to go over to Wodonga to work?
That's one of the options, yeah.
What's your assessment for Sydney at the moment? given that a lot of this activity is based around the border. What's your assessment on a potential infection spike here?
Oh, it's highly probable. And that's because, for example, if you're an Albury resident mixing with Wodongans and there's someone in Wodonga who's impacted, and then you travel to Sydney, I mean, the rate of seeding and infection is extremely high, which is why I've said, I think now 7 or 8 times in this press conference, if you live in a border community, do not move outside your border community. And if you are someone in close proximity to a border community or have interactions with that border community, do not go there unless you absolutely have to. And if we assess that risk to be too high, we will take further action. And I want to make that very clear. As I said, there's a reason why the borders between our 2 states haven't closed for 100 years, because it's extremely difficult. We're one community essentially along those border towns. And we've been focusing on Albury Wodonga, but when you look at Echuca and Moama, and these people don't, I mean, I shouldn't say these people, but our fellow citizens don't think twice about going about their daily business, but there happens to be a state border in between what they're doing. And we appreciate the angst and difficulty there, but I also want to stress, as New South Wales Government, as New South Wales health officials and New South Wales Police, we have no control what happens on the other side of the border. And as I said, we already know there's at least 1 positive case in Wodonga. And we don't know if that's been contact traced, we don't know if that person's exposed others, and because we don't control things on that side of the border. So that is a high risk environment, it's a high risk situation, and whilst we've tried to be flexible to people who live in those one communities, I again put everybody on notice. We're relying on your cooperation with us, we're relying on you doing the right thing, and police have also indicated to me they will have extra checkpoints north of Albury for Victorian plates, but I'm equally worried about New South Wales residents going beyond those border communities who may have had too much interaction with Victorians.
Premier, there are still flights that are coming, obviously, from Melbourne to Sydney, and unlike the long drive from places like Albury into town, they are direct from the main source of infection in Melbourne straight into the heart of our city. Are you concerned that returning New South Wales travellers are going to be the biggest risk to bringing infection to our city?
Can I stress that the New South Wales Government is considering compulsory hotel quarantine of 14 days for those residents, which they will have to pay for. So we're putting everybody on notice, and these are considerations we're making. And I can't be tougher than that in my language, but that is the reality.
Is your message then to people, come home right now if you're going to come home?
Absolutely. I have no tolerance for people who are continuing their lives as normal and ignoring all the health warnings. I have no tolerance for people who aren't doing the right thing by the vast majority, and none of my team has that tolerance either. So we're looking at what we need to do. But again, we appreciate, and I appreciate that the last 24, 48 hours has been challenging for many people. We understand that due to financial hardship or other reasons, people have made arrangements to get back to family or get back to their place of work. We understand that. But that tolerance pretty much finishes once there's been sufficient time for people to make those adjustments. And we are considering, at the moment, if you're a New South Wales resident coming back from Victoria, you have to self-isolate for 14 days. You have to. And can I stress again, we discussed this morning, the police will be checking up on those people. We have their names and addresses. The police will be either going around to their homes or ringing up, as will health officials. So if you've been asked to self-isolate because you're a returning New South Wales resident, you should assume that either a health official or a police person will either knock on your door, give you a call to ask you what your activity has been or what you've been doing to make sure you're respecting that self-isolation, and the penalties are extremely high if you don't. And can I also stress that we are considering our position on returning New South Wales residents beyond a certain point, because there is no excuse if people just want to hang around and have an extra few days because they feel like it. That doesn't cut the mustard. And frankly, if we need to impose people in a forced quarantine situation which they pay for, we will go down that path if we have to. I'm sorry that my language is so strong, but this is a serious situation. It's a major health risk, and it's a major risk to all the good work we've done in New South Wales.
I don't think we've heard you this worried since the start of April.
No, I am extremely worried because I'm extremely concerned with what's happening in Victoria. The extent of community contagion is unlike anything we've seen in Australia, unlike anything we've seen. And our proximity geographically is obvious. Our proximity on those border communities is obvious. And even with our experience with Queensland, New South Wales, whilst there was a border closure from Queensland, we know that many people were still managing to get across the border. But the difference there is, firstly, fewer places of access, but secondly, New South Wales virtually had zero cases up there. And so it wasn't as though that was a health risk to Queensland. It's quite the opposite. But this is a very different situation. This is a situation that we've not confronted. I am extremely worried. I'm always very honest in letting the community know when I'm extremely worried, and I am. And please know that my level of concern will translate into more difficult decisions if that's what we need to do to keep our community safe.
What's the trigger on compulsory hotel quarantine for returning New South Wales residents? When do you make that decision?
Well,
what causes it? And
as I said, in the number of issues that I've raised today, we have almost every few hours I get updated on what's happening, and we will make a decision when we feel it's appropriate. But I want everybody to be on notice. I don't want anyone to feel surprised by what we may need to do in the next few days. Everybody should be on notice. And I appreciate the inconvenience people are going through, but this inconvenience is for our greater good. And the people of New South Wales have been outstanding to date, and we need that to continue. But as we know, it only takes a few cases, a few actions by a few people to really spiral out of control, and I don't want to be in that situation.
Will you make the registering for the COVID safe plan for businesses, will you make that mandatory in reference to the fact that some businesses aren't following the rules?
Well, that's absolutely what we're considering, and we've given businesses now the opportunity to download the checklist, and I'm pleased that 118,000 businesses have done that. That's a lot. 118,000 businesses have downloaded the COVID Safe app, or how to be, or the COVID Safe checklist, I should say, for businesses. But it does concern me that we only have confirmation that around 10 or 12% have actually registered formally. And I'll be starting to ask. I won't want to go to a cafe or a restaurant if it doesn't have that registration. I will ask those questions, and I want everybody else to ask those questions. As you know, I'm someone who's extremely cautious, and I won't subject myself or my friends or my family to a business that may not be doing the right thing. And I want everybody else to do the same. And we've given now the business the opportunity as a voluntary way of downloading the checklist, but we will, as Minister Dominello rightly said, we are going to ramp up compliance. The worst thing that could happen to a business at this stage is if New South Wales had to do what Victoria was doing. That is the worst thing that could happen. So now all of us need to pull together and work together to make sure we don't get to that situation. And that's why I am extremely concerned. I am worried because the risk of contagion in New South Wales is extremely high because of our geographic proximity, because of the number of border communities and the number of permits we're allowing. And if we need to reassess that, we will. But I also know from Dr. Chant that sometimes old cases, people who may have already recovered, might still have elements of the disease and the virus, and that's why I want to thank again all of our health officials for being so vigilant in dealing with, at this stage, the couple of cases that we know of Victorians. And, you know, that case in Merimbula is extremely concerning, where they got tested in Victoria, they were Victorian, they were told they were negative. The family did the right thing, they got tested, they were cleared, they came to New South Wales, and then they were rung up to be told that, oh, sorry, the result was wrong. Now, again, we can control things on our side of the border, we can't control things on the other side of the border. That's a matter for them.
Do you have trust in ways to handle it?
Look, I don't envy their position, but what I need to do, and I've done this from the beginning, much to the chagrin of many, is just stay focused on what we need to do in New South Wales. If we lose our focus here, we run the risk of going down that same path. And so, and again, I feel extremely fortunate to have that strong team around us. Again, the New South Wales Police Force, led by Commissioner Fuller, has been beyond outstanding. And from day one, we had them involved in this pandemic. Whether it's hotel quarantine, whether it's the borders, whether it's ensuring the health orders were maintained. Can I also commend Service New South Wales? As an organisation, they have been the front end of our contact with our citizens, And our citizens feel comforted to know that Service New South Wales is there for them 24 hours a day, 7 days a week, even though when there are periods of change like we have seen in the last 48 hours, it can be frustrating. But to be able to have processed in excess of 50,000 permits, this should have taken us months to be able to achieve. They did it, within 24 hours. An outstanding feat. And thank you to Minister Dominello and to the team he leads. And to the health officials, I am forever grateful that they not only put these processes in place early from Australia Day, but we started our intensive testing from Australia Day. Our ability to have a pop-up clinic or our ability to get a message out and have people respond has been fantastic. And it's the combination of all of these agencies and other agencies that work with us, plus our citizens from very diverse communities, our citizens across the breadth and width of New South Wales respecting the advice we're giving them, and I'm so grateful for that. But we also know now that my level of worry is the highest it's been in quite a while, and I have to be honest about that, and I hope that my frankness and honesty will ask people to think twice about their actions given the situation we're in.
Dr. Chant, can we just ask about...
Sorry, I can't hear anybody. Who hasn't asked a question yet?
Are you considering not splitting communities in half and dealing with all the permits, but pushing the hard border back into Wodonga or around Auckland?
That's what I've already mentioned, yeah. We are looking at that.
So instead of having two borders, you'd remove the split between...
No, we're considering all of those options. We could have two borders. We could have those communities, those border bubbles, for want of a better term, more defined. They're all the options we're looking at, but would also be based on what we see through the results of the testing, but also what we see through activity. Because the police have enormous ability to be able to talk about mobility beyond those border communities. And the police also have enormous ability to talk about what's happening at the border. And to date, the feedback I've received is extremely positive, notwithstanding that there are queues. The feedback through the Commissioner has been that everybody's been responding in a very positive way. So there isn't a single trigger. There's a number of factors we're considering, and it's an ongoing consideration. So there isn't one specific thing, but there are a number of things we need to look at about basing our next decision. But again, I know that many border communities or many citizens feel frustrated with what's going on, and I appreciate that. But please know that the permit system is giving you that flexibility. But if we see that flexibility hurting the rest of New South Wales, we either need to move the border north of Albury, or else we need to be more stringent on issuing those permits. And they're the options we have before us. I hope that was clear enough.
Dr. Chant, can you just run us through some of the details around this 17-year-old the boy? When did they get into New South Wales?
I don't think I gave his age, just for clarity. I said teenager or a young person. Yes.
So can you just give some details when they got here, how long they'd been in Merimbula? Do you know any of that stuff?
Yeah, we do. So basically, I'll just have to review my notes. So the boy and his family are not from a hotspot and travelled to New South Wales on the 4th of July. As I said, at that time they were under the impression that the result was negative and were subsequently advised. Their actions have been exemplary, and they did exactly what we wanted people to do. You know, the child had symptoms, they got tested, they got a clearance before taking those actions. And can I just amplify my message to the community? This is a critical time that for the next period of a couple of weeks, anyone with symptoms of COVID, however mild, I just urge you to come forward for testing. This is a really very critical time for us in the New South Wales response, and I need to find any seeding of the community at the earliest possible time for us to be able to put that containment response around it. It is essential. So, and I just want to thank and appreciate the community. Our testing rates have actually held up pretty high, and it's real credit to the community. And we are doing all we can to make the testing as easy as possible. I do regret sometimes when we have some delays at our clinics, but the community has been wonderful in responding, so thank you.
Someone tests negative, then tests, like, is that normal?
No, it's an error. My understanding, and look, I believe that it was an error, a genuine error, that they had provided a negative result when it should have been a positive result. I think everyone needs to understand that there is a lot of testing overall. and there will occasionally be these errors. What I'm more focused on is the fact that the Tathra Hotel had a COVID safety plan. They had the list of the 80 people. The fact that the family was so responsive in having gone about their business in a very safe way, and we haven't identified more broadly. But as the Premier said, we are urging all of the communities to come forward and get testing, and those regional communities are also making testing easier in those communities, because at this time we do want those high levels of testing.
Last question, please.
Commissioner Fuller.
At what point should you recommend wearing face masks, especially on public transport?
So our current advice is that face masks can be considered in those settings where you can't socially distance. So the most important issue is maintain that 1.5 metres. If you're in circumstances where you are wearing, you can't socially distance, then face masks are reasonable. But the other key message is do not go out. It doesn't give you a licence to go out and about if you've got symptoms. So the message is we do not want you on public transport. We do not want you out and about. We do not want you in workplaces. If you have symptoms, it's important to get tested and stay home. And also, we would urge you to wear face masks. If you're going to use masks, dispose of them safely. Make sure you don't take them off, put them on an environment or a surface, and then allow, if you're sick, could contaminate that surface and infect others. So it is important that if you are choosing to wear masks in those settings, because you're in situations where you can't isolate the 1.5, that you do take some of those precautions. Change them regularly and also dispose of them safely.
What happened with the plane from Melbourne overnight where 48 or 50 passengers or 48 passengers left the airport without screening?
So there was an issue at the airport where passengers were disembarked when the health screening team were screening another airline. The airport have now put in protocols to ensure that the health teams are there and are able to do the screening, and no one's allowed to disembark before that happens. All of those individuals are known. Obviously, you get tickets when you're on a plane. We are in the process of chasing them up. If anyone's been travelled in breach of any orders, we'll refer them to police and take the appropriate action depending on whether anyone is symptomatic to ensure that the community is protected.
What are you looking at just in terms of whether or not we close the border quickly enough? So if the border's only closed yesterday, how soon will we know whether or not it had spread into New South Wales before that, and there will be hotspots that start popping up?
So clearly we need to just be vigilant because the disease has been grumbling along. There's been a range of actions that were taken. So for instance, the Premier has been, and other officials have been messaging, don't go to Victoria for a while. So it shouldn't be any surprise. We have been giving those strong messages. We've also put in place requirements for people coming back, and I've messaged around not going to aged care facilities. We've screened out for over a week any visitors coming back from Greater Melbourne in visiting our health facilities. We've also set up screening for our staff coming back. We have also had the hotspot orders in place and the requirements around self-isolation. So there's been a range of progressive measures, but because the situation in Melbourne has been evolving and there was clear evidence that the disease had spread outside those contained hotspots to a progressive set of suburbs, it clearly is appropriate that we take that next level of buffer. What I'm requesting the community to do is to come forward for testing. And I would urge all of the people around, including the age group of 19 to 29-year-olds who we know tend to present for testing at slightly lower rates. Really, we are urging you at this critical time to come forward and get tested.
Thank you.
Thanks, everybody.
With a 3 Victorian.